Health officials are gathering in Berlin for the World Health Summit. The head of the International Red Cross is focusing on Haiti's recovery from Hurricane Matthew. CCTV's Guy Henderson reports.
In Hurricane Matthew's wake, an emerging health emergency. Help is coming to Haiti, gradually, as the death toll mounts. In Berlin for the World Health Summit, the head of the International Red Cross says a lack of infrastructure poses a challenge for response teams.
In case of Haiti, we're still far from having a strong health system, and we have to be very careful that the health system is able to absorb shock.
But Yves Decour's biggest concerns remain elsewhere.
Syria is a good example. Yemen, you can talk about South Sudan, where you have very few actors like us being really on the ground. And that worries me, because what we've learned is fragile health systems are the one who won't be able to absorb the shock in the future.
That is a focus at this annual event, a post-Ebola wake-up call and the start of a shift towards a far broader approach to healthcare.
Medical advances may be vital to saving lives, but so too, say experts here, are having the right systems in place to deliver them. As one delegate here put it, that's going to require the many different parts of the global health community stepping out of their silos and communicating better with each other.
Because as people move en masse, disease can move with them, and it's harder to track and treat. Rising rates of drug-resistant tuberculosis in Europe is a particular concern.
I believe that new drugs are needed to deal with MDR-TB. It should be shorter period, and only in this way you can manage to win it. Otherwise, migration, it makes even more complicated, and the MDR-TB could develop as a global problem.
Since Ebola, most of those at this summit agree that even an apparently local health issue can no longer be dealt with in complete isolation. Guy Henderson, CCTV, Berlin.